We all know that blood pressure can harm our health in many ways. High blood pressure increases the risk of serious illnesses such as heart disease, strokes, and kidney diseases. To mitigate these dangers, doctors often prescribe blood pressure-reducing medications to maintain safe levels according to general medical standards. The optimal blood pressure is considered to be 120/80 millimeters of mercury. Have you ever wondered if these values are the same for older people? The risk of hypertension does increase with age, and it is also known that hypertension can be hereditary, indicating a genetic susceptibility. However, even if your family doesn't have a history of hypertension, living long enough can put you at risk. If you are over 65 years old and have high blood pressure, you may already be taking medications. You might be wondering what your target blood pressure should be at this stage in your life. In today's video, we will explore the ideal blood pressure levels for older adults. We will analyze the benefits of lower blood pressure compared to the risks of intensive treatment in this age group. If you find this video helpful, please like it and consider subscribing to our channel for more health content. Changes in blood pressure standards. The diagnosis and treatment of high blood pressure changed significantly in 2017. The American College of Cardiology, ACC, and the American Heart Association, AHA, published new guidelines that revised the criteria for diagnosing hypertension. These new guidelines lowered the threshold for diagnosing hypertension, establishing a blood pressure of 130/80 millimeters of mercury or more as the cutoff for all individuals. Prior to these revisions, the threshold was 140/90 millimeters of mercury for individuals under 65 years of age and 150/80 millimeters of mercury for those over 65 years of age. According to current criteria, normal blood pressure is less than 120/80 millimeters of mercury. High blood pressure is defined by systolic values between 120 and 129 millimeters of mercury with diastolic values less than 80 millimeters of mercury. Stage 1 hypertension is currently defined as a systolic blood pressure between 130 and 139 millimeters of mercury or a diastolic pressure between 80 and 89 millimeters of mercury. Stage 2 hypertension is defined by a systolic pressure of 140 millimeters of mercury or greater or a diastolic pressure of 90 millimeters of mercury or greater. Implications for older adults. For older adults, it is essential to control blood pressure. A systolic value of 140 millimeters of mercury, which was previously considered normal for your age group, is now classified as high blood pressure according to new standards. One of the significant studies influencing these revisions is the SPRINT trial, published between 2014 and 2015. This study aimed to investigate the impact of increased blood pressure control on cardiovascular events and mortality in individuals at high risk for cardiovascular disease but without diabetes. It is important to note that the study excluded patients with dementia and those who had previously suffered a stroke. The study included 9,300 people aged 50 and over who were at high risk for cardiovascular disease, with a mean age of 68. Participants were randomly assigned to one of two groups. The first group received standard treatment with a target systolic blood pressure of less than 140 millimeters of mercury, while the second group received aggressive treatment aimed at reducing systolic blood pressure to less than 120 millimeters of mercury. This aggressive strategy involved prescribing stronger medications to maintain systolic blood pressure below 120 millimeters of mercury over a 3-year period. Researchers meticulously monitored both groups to determine side effects, the development of chronic heart conditions, and mortality rates. The results were significant. Each year, 2.19% of participants in the standard treatment group developed serious cardiovascular diseases, compared to 1.65% in the intensive treatment group. Although the risk of cardiovascular events was lower in the intensive treatment group, this approach was not without disadvantages. Participants in this group experienced a higher incidence of adverse events, particularly hypotension, electrolyte imbalances, and acute kidney injury. These data imply that while careful blood pressure control can reduce cardiovascular risk, it may also increase the risk of other significant health problems, especially among older adults. Another important study is the CHART trial conducted in 2021, which compared the effects of intensive blood pressure control with conventional control among nearly 20,000 Chinese individuals aged 60 to 80. This study found that targeting a systolic blood pressure of less than 130 millimeters of mercury significantly reduced the risk of serious cardiovascular events, including strokes, compared to a target of below 150 millimeters of mercury. Similar to the SPRINT study, intensive treatment in the CHART trial resulted in a higher rate of adverse effects, such as hypotension and kidney damage. However, it was also associated with a reduction in all-cause mortality. Setting your blood pressure goals. So, what should your blood pressure goal be? Many doctors advocate for a more individualized approach, treating each patient based on their medical history and circumstances. Although studies like SPRINT suggest it can be beneficial to achieve a systolic blood pressure of 120 millimeters of mercury, this may require taking multiple medications that can cause unpleasant side effects. It is essential to monitor these side effects, especially those caused by blood pressure medications, which can be detrimental to older adults. Some individuals, particularly those with multiple health issues or who are more vulnerable to the side effects of intensive treatment, may benefit from a more conservative blood pressure target, aiming for a systolic pressure below 140 or 150 millimeters of mercury. This may provide a better balance between reducing cardiovascular risk and limiting potential hazards, such as falls caused by hypotension. It is also critical to understand that high blood pressure is a normal part of aging. Various physiological factors contribute to this, including the loss of elasticity in blood vessels, hormonal variations, and abnormalities in renal function. Arteries harden over time, and hormonal changes can influence how the body manages blood pressure. These changes are